I'm going to show you guys how to perform a sterile wound change, also how to maintain a sterile field, and how to apply a sterile gloves. Okay, so first you want to perform your hand hygiene. So you make sure you get palm to palm in between the fingers, the back of the hand, and then you want to protect the patient's privacy and respect them. So you draw any curtains and you close any doors if necessary. Okay, then you walk up to the patient. Good day, Miss Skipper. I am the student nurse Rae-Yanne, and I'm going to change your dressing. But before I begin, could you tell me your name and your date of birth?
Minnie Mouse, 16th November 1948.
Thank you. So to begin, we're gonna apply gloves for us to remove the wound, the bandage that the patient already has. So I'm going to open the tray, the sterile tray. That's, you have done your hand hygiene and everything. So you're gonna open the sterile tray. Make sure it's away from the patient. Okay, and then you're going to touch the outside of the glove package, and you don't want to touch anything inside. Okay, then you open it up and you place it away from the sterile kit. Okay, so now you want it on the dominant hand first. So you can touch inside of the glove with your non-dominant hand. Okay, that's the inside, and then you put your hand and only touching the inside of the glove. Okay, and then with your dominant hand you touch the outside of the glove. Okay, and you place it on your non-dominant hand. Make sure it doesn't get the inside. Okay, so after you have applied the gloves appropriately, now you go into the sterile field, the tray, and you're gonna remove the garbage bag. You don't want to touch it too much. Make it open up by itself. Okay, and then you're gonna place it on the patient. Make sure you get the inside. You fold it up a bit so it's easy for when you're changing the wound, for the stuff to come easily. Okay, so you first start off by examining it, and when you're taking it out, you want to take it out first from the place that is least contaminated, so where the wound is the least. Okay, so you open it up. Okay, and then you place this one in the bin. Okay, and while you're taking out each section, you want to observe the inside. You want to see if it has any drainage, and you want to record anything that you see, and then you put it in the trash. Then you want to remove those gloves, and you will get some new ones. So in this video, I won't remove it and put new gloves. They say this is the new gloves. Okay, so then you take your solution. Okay, you want to put this out as well, and you want to place it, okay, and then you have the solution and all this stuff. Okay, so when you're dressing the incision or the wound, okay, you want to get it from the least contaminated to the most contaminated. So you would, and then for each stroke, you will throw it and you continue with a new one until it's clean. If the person has a drain, you go in circular motion, and then from the least contaminated to the most contaminated, and then you do it until it's clean, and you always use a clean gauze. Okay, so now when you are covering the dressing, you want to put some of this on top of the wound itself. And if the wound has any drainage, you want to put it there as well, so at the bottom. Okay, then you want to put the abdominal pad on top. Okay, and then you're gonna tape it at least 2 centimeters away, 2 inches, sorry, away from the wound itself. Okay, so you're gonna put it everywhere at the bottom as well. And I forgot to mention that after you dress the wound, you're gonna take out your gloves, and you're gonna, for the replacing, for it to put a new bandage, you're gonna take out those gloves and you're gonna perform the sterile field again. So you're gonna put your sterile gloves and you maintain the sterile technique. So make sure when you have the sterile technique, you do not go like over the sterile technique. You want to maintain it and make sure that your hands are above the abdomen to maintain that sterile technique. Now, if the sterile technique is broken, you need to start all over. So you'll have to start the whole process again. If it's wet, if the towel gets wet or contaminated, you need to start all over. Or if you have gloves, things that are not sterile, on the sterile stuff, you need to start all over. Okay, so after you're done with this, you want to remove the gloves. Okay, and when you're removing the gloves, you go like this. Okay, then you dispose of it, and then you will ask the patient, but you assess the patient's pain. So you ask them, after you change the wound, ask them how is the pain, rate the pain from this from a scale of 1 to 10. Okay, and then you make sure that the patient is good. You dispose of your garbage, and you make sure you put them in the appropriate area. You dispose of them appropriately. Want to cover the wound. Okay, and then make sure the patient is comfortable. You perform hand hygiene, and that's it. Thank you.